Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. But prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to healing.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So, hindi niya na nararamdaman na may natapakan pala siya. So, probably, yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so anong plano mo? Sabi ko, pa-check na natin yan. So, pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot. Tapos, tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After ng 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya. Hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos, yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then, secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung man ako binayaran So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titignan mo naman yung long term na gamutan, mas mahal yun. Tsaka hospitalization. At yung syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa, malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPARS. Pangalawang gabi, ninaramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera. Siguro, mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang, maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. Ay, Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
Good evening, everyone. Welcome to another episode of Simply Healed Webinar. I'm Sheila, your host, and we are so glad to have you with us tonight. Today, we are diving into a real science-based solutions for better health. To quickly recap last week's webinar, we tackled a powerful topic entitled Cancer Prevention by Managing Inflammation. It was truly an insightful session filled with meaningful questions that our experts addressed with clarity and care. Now, this October, we honor every woman fighting, surviving, and thriving through breast cancer. And we shift our focus and attention to a profoundly important topic entitled Early Detection That Saves Lives Beyond Just a Mammogram. Now, before anything else, I just want you to hear this from us. We understand the fear that can rise when a test suggests you might need more. An ultrasound, an MRI, a biopsy. It's normal to worry, to think, and what if I just stop here? We are here for you. Early detection saves lives, and going forward with the recommended diagnostic steps is an act of courage that gives you more clarity and control. Today, this topic is early detection that saves lives beyond just a mammogram. Mammograms are powerful, but real protection is a plan shaped around you. Alongside screening, many of our community also ask about nutritional support. We'll touch on Simply Nature PPARS, a microalgae-derived supplement that many use to support balanced immune activity and a healthy inflammatory response. It doesn't replace medical care or screening, but it can be a part of the whole person approach. Let's walk with this together. When most people think screening, they think get a mammogram and done. Smarter care is personal. The family history, breast density, and age help your doctor choose the right path. Standard or 3D mammography, ultrasound to clarify a finding, or MRI for higher risk. You don't need to know every machine. Just share your story so the right tool meets the right moment. Awareness matters too. You don't need a perfect at-home technique. You need to notice change. We always say this, know your lemon. Is what you have a new lump, thickening, dimpling, a nipple turning inward, unusual discharge, especially bloody, or anything that feels off and stays? Get it checked. Most changes aren't cancer, but time matters. Simply Nature PPARS are cellular regulators that help the body manage inflammation and metabolic balance. A microalgae-derived supplement is used by many patients and clinicians as complementary support, often described as helping with the daily resilience, appetite, and energy while staying on the course with a doctor-directed screening or care. It does not replace evaluation or treatment. It sits beside them. So if you're considering it, especially dense breast follow-ups or between appointments, discuss it with your healthcare provider. When to start and how often? Follow local guidelines and your clinician's or doctor's advice. Many average risk women begin in their 40s. Higher risk women may start earlier than MRI and add MRI. The key is consistency. Put it on your calendar. Keep your follow-ups. Don't let fear stall you or the doorway of your answers. Daily habits set the stage. Steady weight, regular movement, good sleep, less alcohol, no smoking, and anti-inflammatory whole food meals. They don't replace screening. Once again, they strengthen long-term health and help your body send clearer signals. The heart of it, we understand the fear, but going forward is how you protect your future. Early detection isn't just a mammogram. It's the right test at the right time for the right person, supported by wise habits, and for many, complementary nutrition like Simply Nature PPARS. The intention of today's webinar is to make sure we answer more questions coming from all of you, for us to be able to empower you even more in your journeys. So without further ado, let's dive right in. Leading tonight's AMA is are highly respected health experts. First off, it's an honor to introduce Dr. Jansen Calalan, a graduate of St. Luke's College of Medicine and a diplomat of both the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine. Currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Another expert that will be joining us on our AMA, he is a successful entrepreneur and seasoned international speaker, wide range of topics, who brings deep insights into personal health and success. He is the CEO and founding director of Simply Nature International and PPARS expert from Singapore, Mr. Shyan Lim. Good evening, Dr. Jansen. Good evening, Sir Shyan.
Good evening, Sheila. Good evening, Doc.
Hi, good evening.
Doc, we have dinner tomorrow with Dr. Jaime.
Yes, I'll see you both tomorrow.
Yeah, I look forward to our discussion. So, to our viewers, me and Dr. Jansen do catch up apart from the program, and we do meet up with other doctors. Dr. Jansen just came back from Japan, right, Doc?
Yes, just came back.
From a orthomolecular conference, if I'm not wrong.
Yeah, the Japanese Society of Orthomolecular Medicine.
Wow. We'll talk more about that tomorrow when I see you in person, Doc. Let's go.
Sure.
Let's go to our questions tonight.
Well, welcome to the both of you from Japan and also from Singapore.
Yeah, I touched on yesterday too.
Yes. All right, but for our first question, all right, what is the best modality to understand if we have breast cancer?
Depends on what stage you are in and how severe the disease is. If you still don't have, any tumor or any clinical manifestation of cancer, then the best way to know whether or not you have cancer or not would be a liquid biopsy test. So the liquid biopsy would look into your white blood cells and analyze your white blood cells if they are expressing genes that are, how do you phrase this? No? So you understand better. Yes, will analyze your white blood cells and look at them if they are showing weapons against cancer. So if the white blood cells are showing weapons against cancer, then chances are they might be fighting cancer in your body. So that's a good screening tool to get the next steps of diagnostics. To trigger the next steps of diagnostics. So if that is positive, then you have to check where a possible tumor might be. So that would warrant scans already, not just for the breast, of course, no, because at this point you're still not having any clinical signs and symptoms of whatever cancer. So you're trying to find a needle in a haystack, okay, so to speak. Now, it would be different if you are already manifesting symptoms of breast cancer. So say, for example, you have a breast mass. So the next step would be to check an ultrasound. Go for an ultrasound mammogram. So from that, you would be able to get signs or get a better glimpse, a better picture of what the tumor looks like. Check if there are characteristics leaning towards cancer or malignancy. Then if the probability is high that the tumor might be cancer, then that would warrant biopsy next. Because you would want now a confirmation whether the tumor is actually cancer or not. The advantage of the biopsy is it would also show you what treatment would be would fit you if it is in case it is cancer. Yeah, so that's the step-by-step process.
Yeah, it's a really interesting talk. I was just speaking to some patients and friends in Singapore. Was telling them about the liquid biopsy. So it's something new to them. Yeah, even though the RGCC lab, I think they have a lab in Singapore. They're setting up one in Singapore, I think.
Mm-hmm.
Yeah. Sheila?
With how you explain it, Doc, it's no wonder why other doctors are really suggesting observation at the onset, and for some patients, they are really makulit in terms of you have to go for biopsy right away, something like that. Thank you so much, Sir Doc Jansen. All right. For our next question coming from Mr. Liam, how safe is it to combine PPAR supplements, with statins and anti-hypertensive drugs?
Okay, for me, I would not combine them, or I would not take them at the same time. So this is because Simply Nature PPARS is made from Chlorella sorokiniana. So the family of Chlorella, it's microalgae. They are chelators. They bind to things. Now, we don't have any studies if it binds medications like statins or antihypertensive drugs. We do not know that. Okay? There's no study that I have found that indicates yes or no. So just to err on the safe side, what I advise patients is to take Simply Nature PPARS separate from the medications. Okay, now there are some supplements that you can mix Simply Nature PPARS with, like your probiotics. That would be perfectly okay. So, and other probiotics for that matter, no. So those are okay. Those are fine, no. So and that's the reason. That's the reason why I usually advise patients not to take them together. Okay, but again, evidence-wise, there's nothing that shows whether or not Simply Nature PPARS or Chlorella, for that matter, binds medications. Okay, but just to err on the safe side, take them separately.
Yeah.
Okay? Yeah.
Just wanted to follow up because some viewers might misunderstand you that you cannot, if you are on statins, you cannot take PPARS. Doc just means that you cannot take it simultaneously. That means you cannot put it all in one hand and eat it all at one sitting. So you separate it. Actually, that's why we always advise patients also. Why? Also, please don't take your PPARS with coffee. Okay. Again, like what Dr. Jansen said, separate it. Number one is PPAR supplements cost you money, right? So you want to take them on an empty stomach for better absorption, so that it doesn't mix with anything else, in the possibility that it gets binded or the effects get reduced, right? So yeah, that's it. Just want to clarify that.
Thank you. Thank you for clarifying, Dr. Jansen and Sir Shyan Lim. Definitely, but I just want to reiterate, of course, our PPARS have no contraindication with other medications. You just have to take it accordingly as per your doctor's advice. So, okay. All right. For our next question coming from thrown privately by Mr. Rico, can PPARS help with high creatinine? What PPARS form should I take?
Doc. Doc, you're breaking up. Doc,
Right. Can you repeat the answer, Doc? You're choppy a while ago.
Yeah.
Okay. Very taking shot. Okay, so there are things getting certainly in a lot. No, doesn't mean kidney function. There are a lot of supplements that you're taking, muscle breakdown, etc. Okay, but to just answer the question per se, no. So I answered in the context of CKD. So say for example you have CKD, it's very important what kind of extract you take. Okay, it should be powder and powder only, for that matter. No, this is in general for everybody. Reason being is sometimes I notice those extracts that you swallow, they sometimes increase the creatinine rather than go down. Okay, so to avoid yung PPARS getting metabolized by the liver and interacting with a lot of things in your gut, I advise powder, because powder it goes directly into your bloodstream and it bypasses the intestine in the liver. Okay, so so that's my answer.
Thank you, Dr. Shyan.
I hope you understood.
Yeah. Okay, guys, if I'm looking like that, it's because I have two screens on my iPhone now. But let me answer. Let me share this one also. First of all, depends on why you want your creatinine to come down, as Doc mentioned, in CKD patients, right? So in CKD patients, we have seen patients who's improved a lot. And this one is like, for example, Doc Louis patient, and I also know of Doc Jansen's many patients who either delay their dialysis or manage to, in Dr. Louis' case, actually managed to avoid. But I want to talk about one specific case that I was personally attending to. The patient was going for kidney transplant. So really quite serious already, and he wanted to try something to see if he can avoid. At that time, he chose to do Simply Nature PPAR soft gel capsules. Okay, so number one, after 1.5 months, for this particular patient, his creatinine didn't come down. But again, there are many reasons why your creatinine stays up. But what happened was that his other aspects of his blood works improved, right? So his diabetes came down, his blood sugar came down, blood cholesterol came down, he felt better, he felt stronger, and just nice, right? After 3 months, he actually received notification that that there was a kidney transplant available for him. And he was in a good position to go for his transplant because he had been strengthening his health through lifestyle changes and through Simply Nature soft gel capsules 2 months prior to that. So I just want to say that when we go for a particular disease like CKD, when you make good lifestyle choices and you take supplements like Simply Nature to strengthen your body, I know you're taking it for CKD, but also know that it's other functions, right? You will never be doing yourself harm, and you will put yourself in a better position for more medical options if anything comes up. So I just want to encourage everyone that, many people say, want to go natural. What people mean is that they want to take something natural to treat their illness rather than a drug. But when you talk about going natural, you should also think about strengthening your body and getting your other comorbidities and basically your general health apart from your illness strong and rectified, right? So this is so that the options that are available to you to treat your actual illnesses actually increases if you are healthier, if your other organs are better, if you don't suffer from blood cholesterol, blood sugar. It makes potential, for example, the kidney transplant surgery, all that much safer as well, right? So I just want everybody to also, every time people ask us questions, they are very focused on their illness and only on their illness. But you got to remember, when you're not feeling well, when you have CKD, there are other things that make your life miserable, right? Your fatigue, maybe you feel feverish because of the constant inflammation in your body. If you have blood sugar issues complicating your CKD as well. So, when we say go natural, we should think about getting your whole body treated, not just your particular illness. Yeah. Thank you.
Thank you, Dr. Jansen. Thank you, Sir Shyan Lim. Okay, so for our next question, coming from Miss Susana. So, can PPARS help with myasthenia gravis, MG?
Okay, that's myasthenia gravis. Okay, so myasthenia gravis is an autoimmune disease that targets your how should I say this in simpler terms?
I'm learning something new. This is something new to me, Doc.
Me too.
Okay. I'll try to make you understand it simpler now. Okay. So how do you move your muscles? So the brain sends a signal to your muscles, so the muscle will contract, and then you move. Okay. So along that signal, how does it go to the muscle? So you have your nerves. So your nerves, just before it reaches your muscles, you have a space there called a synapse wherein neurotransmitters are being secreted. So the neurotransmitter's job is to communicate with the muscle. So the muscle will contract. Myasthenia gravis does not have a receiver to receive that that neurotransmitter. So in other words, it doesn't have the antenna necessary to receive the signal. So if you do not have the antenna to receive the signal, then the muscle will not be able to contract. So the reason behind this event is an autoimmune origin. Okay. So now with myasthenia gravis, there's a presence of background inflammation, but that's about it. No. So the role of PPARS here would be to help improve the inflammation, but not. So it's for symptom improvement, but it's not a cure. It's an adjunctive treat. It's an adjunct supplement for you, okay, to help lower the inflammation. But again, it's not a treatment. Will it help myasthenia gravis? I don't really know. Okay? In theory, yes, by reducing the inflammation, the background inflammation. But do we have evidence or studies showing that there is in fact an improvement, a measurable improvement? I don't know.
Doc, can I ask, how is this condition like similar or different to lupus and eczema, psoriasis?
Yeah. So autoimmune diseases, the common thing about them is the immune system is attacking the host. So the host, there are different parts of the human body, physically, chemically, chemically. So each and every one of these parts can be attacked by the immune system. So in myasthenia gravis, the part that is being attacked is that synapse. It's that synapse that's connecting the nerve and the muscle.
Wow. So,
okay, so that's
pain? Yeah. So is it bad pain?
No, you won't feel pain with this. The most common symptom with this is you cannot move. You feel lethargic, you feel slow. Sometimes paralyzed sometimes, or it's generalized weakness.
All right.
Yeah, so that's the number one symptom of this.
Okay. Wow. I mean, I was checking with Dr. Jansen because Simply Nature PPARS extract is actually very useful for psoriasis and eczema. More than not just the inflammation part, but actually help with how the immune response of the body. So it also helps with lupus. We were also kind of worried in the beginning with lupus, but because lupus is an autoimmune deficiency, and if your immune system actually gets strengthened, then it attacks the body even more. So of course, if we just understood PPARS as strengthening the immune system, then we would be very concerned. But it actually helps to modulate the mechanism of action of how it actually does that. We don't have a very in-depth studies, but we have quite a few. We have quite a few studies, but not. But autoimmune has many factors. Just like, for example, we did a study on reaction to allergies. So in that studies, we found that it actually prevented alveolar infiltration. So that's really very specific, right? It prevents infiltration into the lungs. And the mechanism for that does not definitely immediately translate to other autoimmune diseases. So I can only say that if you're looking for a solution, and if you have not found any good solutions out there, you've tried many things already, then why not try soft gel capsules, all right, and then observe. The good news is that there is only going to be benefits for you, right? There's only going to be benefits for you. It's going to help with your metabolic syndromes if you have any of your blood sugar, blood cholesterol, and as Dr. Jansen mentioned, we do know its effects on inflammation. As per whether it would be able to help your condition specifically, we really don't know, but there's no harm trying. Yeah, and in fact, there are other health benefits that you will benefit from. Yeah.
Thank you. And it would be best, Dr. Jansen, to continue with the treatment for the meantime to get
Yeah,
the
definitely. Continue with your medical treatment.
Agree,
Thank you.
agree.
So for those of you who wish to have a consultation with Dr. Jansen Calalan, just simply type in how to consult. Our caring HCS, Ms. Beth and Ms. Irish, will definitely get in touch with you individually. All right, for our next question, coming from Ms. Luzbeminder Rinen. Oh, just a second. Good evening po. Is it true that PPARS virus is pang-ultimatum daw sa cancer? Ultimate option for cancer, so that it won't spread and prevent metastasis.
Okay, it can help with all this. Now, cancer is a very specific individual disease, right? So we can't lump it all together. I will tell you that Simply Nature liquid extract is the best in our whole PPARS range. As long as it's cancer, even Dr. Jansen would most of the time default to that. So I want to say is that what I want to share is that it doesn't work on the cancer, it works on your body, right? So it will strengthen your body's many responses to help you fight cancer. So unlike a chemotherapy drug, which is designed to kill the cancer cell, specific drugs kill specific cancer cells. So that's why the doctor can say very confidently to you that that drug will attack and kill cancer cells, right? So it is a treatment, right? But for Simply Nature PPARS, it doesn't work on the cancer cells, it works on the body. It really strengthens your body, modulates immune response, inflammation, many factors, that it becomes a very powerful support tool, depending on how you approach with the protocol for you to treat or manage your cancer. So I can say, yes, Simply Nature PPAR Liquid is the best of the best that we can provide. All right. Yeah, Doc.
There are a lot of factors that makes cancer metastasize. Okay. Simply Nature PPARS is one tool that we can use to help slow down the spread, but not the final answer, or not the only answer to this.
Yes.
Ultimately, it would be best to get a liquid biopsy first and see the gene expression of the cancer and test if PPARS liquid can actually help in mitigating the metastasis. Okay, so that's the ultimate test that we can do to answer your question for sure. Okay, because cancer is different from one patient to another. Different. Okay, even if they are under the same type. So say for example, breast cancer, same type, ER/PR positive, HER2 negative, for example, the same subtype of cancer, but different individual. The gene that gets expressed from this are also very different. Okay, I'll repeat, no, so to avoid confusion. So you have two individuals, two patients with the same subtype of breast cancer. Okay, ER/PR positive, HER2 negative, for example. Even if they have the same subtype, the genes that the cancer expresses are totally different. So sometimes one substance would work for one, but it will not work for another. Okay, so you cannot generalize things. But to answer your question, yes, it can. It can help prevent metastasis or the spread. How does it do that? It reduces inflammation. That's basically the answer. But will it apply to one patient or to the same patient? It won't. Because of this factor, because of the difference on how the cancer expresses its genes. Okay, so sometimes it works for another patient and it doesn't work for another patient. Okay, yeah.
Okay, for this particular viewer, let me give you a unlimited money solution scenario. Okay, so let me give you the best that you can do. All right, number one, if you've been diagnosed with cancer, you are worried about the cancer progressing, and of course you want to avoid metastasis, and you don't know whether Simply Nature PPARS is going to be how big a role it's going to play in your cancer, then this is what I will say. if money is not an issue, start with liquid PPARS, all right, for how long? 2 weeks to a month. But at the same time, go for an oncologics test that the Dr. Jansen suggests. So what you do, you actually send one vial of the liquid together with your blood to overseas for them to test what it will do on your cancer with your cancer cells. Why? Because if from there it shows to be very specifically for you, very effective. And give you one example. We actually have a patient who sent her blood samples to RGCC, and it showed that the cancer cells was undergoing apoptosis higher than when not exposed to the liquid PPARS. So literally, it was causing the cancer cells to die, right? So that's a very specific. So why would you want to do that? Because now you zone in and know that the liquid PPARS is going to work for your specific case in such a clear way. Then you can increase your dosage to like 2 vials a day, and so that you will know where to concentrate your finances, your money, and really go and laser focus. On the worst case scenario, we are very, very sure Simply Nature Liquid Extract is going to support you very well in your cancer fight, right? Give you energy, reduce inflammation, a whole host of benefits. Whether or not it's the key thing that will help your cancer, kill the cancer, that depends on each individual. But will it help with your fight against cancer? Yes. So the best case is you start on it, you enjoy, like, for example, the stronger energy level, high energy level, so that you can go through whatever other treatments you're going through. You send it for onconomics tests to confirm whether this should be one of your primary protocols, where you put more emphasis on depending on the results that come back. So I guess this is the dream. If money is not an issue, this is like the best option if you want to explore Simply Nature PPAR Liquid. Yeah.
Thank you. This is actually a very valid question and a common question coming from our patients. So thank you. Thank you for asking this one, Ms. Lasviminda Rimnin. And thank you, Doc Jansen, and thank you, Sir Shyan. Once again, should you wish to have a consult with Doc Jansen, simply type in how to consult. I think I like what I like about Doc Jansen explanation is that I think this liquid biopsy would tend to make it the treatment more tailor fit for the patient, since even subtype of breast cancers could be of different pathways for two patients. Yeah. Thank you, Doc. Thank you, Sir Shyan. Right, for our next she has a follow-up question. All right. Are you BFAB or is PPARS BFAB approved already?
Yes, it is. It's BFAB approved, it's FDA approved. It's even listed in MIMS, which is the doctor's handbook for drugs, or catalog for drugs, right? And down there is actually listed for some chemotherapy support to reduce chemotoxicity. Yeah.
Thank you. All right. Just before we go to our next question, just want to greet Ms. Chris Villanueva, a valued client of Ms. Jhen. Hello po. All right. So she actually has a question. What is the best product for swollen lymph nodes in the neck or on the neck?
Okay, swollen lymph nodes have a lot of reason. Can be infection, can be inflammation, can be, well, cancer if you have a known tumor. So it depends on what is the root cause. You have to give the treatment for the root cause. Yeah, so I cannot answer your question really from just this information.
Can I go back to the MG question, right? Yeah, so I'm just looking up some references. It's very interesting that PPAR gamma agonist pioglitazones, which is a drug, right, actually reduces inflammation and disease severity, right? So there are a few things. Is because of enhanced Treg function regulation. Okay, so the conclusion is yes, there is no clinical trials for this, because nobody actually took this to test this for MG. But it's interesting. It's a hopeful thing that pioglitazones, which is a PPAR-based drugs, actually show to reduce the disease severity, but it doesn't treat it, right? It just reduction of disease severity. So if you're looking for something, yeah, again, you no harm trying, no harm trying. And the difference between us and taking pioglitazones is pioglitazones are actually drugs. So these are synthetic drugs. The mechanism of action is similar, but the triggers are different, right? They use synthesized drugs to have the same to trigger the same mechanisms. All right. So just for that particular patient, okay, it's positive, right? Nothing conclusive, but there's some positive potentials. So if you are really looking for a solution, because I guess if you will come to our program and ask us this question, you must be feeling a certain sense of frustration and wanting to look to see if there's other avenues where even if it's just to help out, it will you're trying to look for possibilities. And again, like the treatment of cancer, sometimes when we treat a disease, it's not just one pathway, right? It's just not because you take drugs, then you can avoid having a healthy lifestyle. It's combination, targeting your illness from different angles. So take Simply Nature PPARS as a form of strengthening, nourishing your body. And on the offside, let's see if it has any physical, any improvements that you can tangibly feel. Okay, yeah. Okay.
Thank you, Sir Shyan. Dr. Jansen, just want to go back to the question about swollen lymph nodes on the neck. So she said that last year she had
more details.
Yeah, more details.
Ask for details. So
very good, Miss Chris. Okay, so last year she went for CT scan, and the result is it's just an infection. So they gave her antibiotic. Okay, but it didn't decrease or lessen. There are times though that it disappears and then it comes back, and it also has pain.
Still, the information is insufficient for me to, answer or give a definitive, treatment recommendation. Ultimately, it has to be identified what is the cause of the enlarged lymph nodes. So biopsy must be done if you had antibiotics already, but the enlarged lymph nodes are persistent. So yeah, that's my recommendation. Do more diagnostics so we know what we're fighting.
Yeah, I think many times patients who ask us on this program, we want to remind our program is only for education. It's not a diagnosis and recommendation for your specific condition, right? Because you're not giving us enough details, not at all. We can't even see your face. All right, so there are many things that are so important, both in TCM and in conventional medicine. Just seeing the patient alone has so much information, right? From the color of their face, everything, the way they stand, they walk, how you talk, all this is so important. That's why, so do remember, our program is just helping you to understand. So we're giving you like some viewpoints and some understandings of mechanisms so that you can make better choices. All right, so you know how to continue to investigate. As again, if you're asking Dr. Jansen for his specific advice, I will tell you, go have a consult with Dr. Jansen, all right, so that you will actually present your patient files, you'll send your scans and your reports before the actual consult, and Dr. Jansen will be able to then give you professional medical advice. Yeah.
Thank you. All right. Well, once again, the title of our webinar tonight is Early Detection That Saves Lives Beyond Just the Mammogram. And just like the breast cancer case, I think the encouragement coming from Dr. Jansen Calalan and of course Sir Shyan Lim is for you to go further, not to stop at some point.
Yep.
Because at the moment, if you are asking this question, and I'm pretty sure that you are feeling something is off within you, so go further with the diagnostics and have a consult with Dr. Jansen if you want. Okay. All right. For our next question, coming from Ms. Lei Chu Tai. What type of supplement to take a Crohn's disease and how to take it?
A lot. So
what is Crohn's disease, Doc?
So Crohn's disease is basically inflammation of your bowels.
Oh wow!
Now Crohn's disease also has an autoimmune background. autoimmune cause. So this time, the immune system is attacking your bowel. Okay. Now for Crohn's disease, it's important to modulate the immune system. So to tone them down, improve antioxidants, improve your gut health. Okay, so that's the general approach. So how do you do that? No, for autoimmune diseases, vitamin D3 therapy is very important. So you don't just take vitamin D. Okay, you have to follow the Coimbra protocol. How do you do that? What is that? You have to consult a doctor who knows how to do it. Okay, that's number one. Now, for autoimmune diseases, I should say that vitamin D3 is central. So a lot of autoimmune diseases can be addressed. No, the problem behind this can be addressed with just supplementation with vitamin D3. But the question of how much to take, you have to follow the Coimbra protocol. Okay, so that's part one. Part two would be to fix what you're eating. The food has a very big impact.
Wow.
When it comes to in patients with Crohn's disease, because patients who have Crohn's disease also have leaky gut. So leaky gut is when the permeability of your intestine is bad. Okay, so it absorbs things that should not be absorbed. That's why you get sick or you manifest a lot of symptoms that is not related at all with your digestive system. So that can be rashes, asthma, whatever. Okay. So you have to address the leaky gut as well. How do you address leaky gut? You have to take probiotics. You have to take prebiotics. Now, Simply Nature PPARS can form part of the protocol as a prebiotic and as an antioxidant. Okay, but it's you have to take other things. Okay, some are saying that postbiotics are also quite good to take. So postbiotics are byproducts of bacterial probiotic interaction. These are byproducts of them, no? So some are saying that it's good to take this, but I'm not that. This is quite new. No, this is quite new, so I'm not that knowledgeable about it yet. But definitely, you need prebiotics and probiotics. Okay. What other things should you need? Well, your medications, of course. No, so medications that your rheumatologist or gastroenterologist might prescribe you with to help control your immune system or control inflammation would definitely be helpful. But again, these are only meant to help control symptoms, not to address the root cause. Ultimately, the root cause here is gut dysbiosis and hyperactive immune system. So you have to control these two to help people with Crohn's disease. Yeah.
Well, I'm looking at Crohn's disease. Then I saw a word that I learned from you. JAK inhibitor. I remember you shared this. We were doing a taping. You were giving quite a in-depth about JAK inhibitor. The summary was very interesting. It says that solid mechanism rationale, but again, we don't have any specific test specifically for Crohn's yet. But the mechanism, yeah. So wow, what? I don't know whether you want to comment on that, Jack. I just thought it was good that I felt, oh, this is what I learned from Dr. Jansen. I think 3 years ago, he talked about JAK inhibitor, JAK inhibitor, yeah.
So this is you said this is gut issue. Can Cleansing Plus help as well?
Yes. Cleansing Plus is a prebiotic. Does it have? It's a prebiotic, so it's made from psyllium husk and a lot of antioxidants.
Not probiotic, it's a prebiotic.
So it can help. It can help. So this is important for patients who have trouble eating vegetables or getting their fiber in. So you can take this.
Thank you, Doc. Thank you, Sir Sean. Okay, for our next question coming from Ms. Joanne Vergara, how about if there's if BIRADS 5 ang bukol or the lump in my breast, but I don't want to go for operation or needle biopsy? BIRADS 5.
Okay, so what to do then? with 𝘬𝙪5, then we have to know for sure what if it is cancer or not, no? So if you don't want to go for surgery or needle biopsy, then go for liquid biopsy. So the liquid biopsy will show us if indeed this is cancer. Well, chances are it is, no? Then show us what natural extracts would be useful to kill the cancer cells. So that's the definitive. That's one thing that we can do. But to do this properly, I have to talk to you. Because if we follow the guidelines, if we follow guidelines, no, you have 𝘬𝙪5 of a breast mass, then establishing whether this is cancer or not would take priority first. So if you're okay with blood sample, then I would advise you to go for OncoDeclare. So OncoDeclare is the test to know. It's a screening test, no? To know for sure if a patient has cancer or not. If it is positive, then we can go for OncoTrace. OncoTrace is the test to use to know if there are circulating tumor cells in your blood. Why would we want to go for this first? Because in the off chance that your breast mass is not yet advanced in stage, then this might turn 0, and it would not warrant the onconomics test, which is a more expensive test. So yeah, this is what I'm saying is the step-by-step track, no, for you that you can follow if you don't want to undergo needle biopsy. Now, the next step is if there are circulating tumor cells, then the next step would be to go for the onconomics plus to determine the treatment, whether it be natural extracts or chemo. But there would be no sane oncologist who would do chemotherapy or whatever treatment for cancer that if there's no tissue biopsy. So at this point, I would suggest just to go for the natural extracts panel to know for sure what natural extracts can be used to help kill the cancer cells or to help control the cancer. So that is if the circulating tumor cells are present in your blood. Now, if the circulating tumor cells comes out 0, then it's either your breast mass is not cancer or it is cancer, but it is in the early stages of disease. In other words, it hasn't spread to, it hasn't invaded your blood vessels yet. That's why the circulating tumor cells is 0. So if it is 0, then you're still in limbo because you still don't know what to do.
So the 𝘬𝙪s, they rely on physical representation of the buccal or lalam, correct?
Yes. The 𝘬𝙪 scoring is a scoring tool that we follow to know the probability of malignancy. The probability of malignancy. So the higher the number is, the higher the chance, the higher the probability of cancer diagnosis. So 𝘬𝙪5, if I remember correctly, 𝘬𝙪5 is it means that the breast mass is highly suggestive of breast cancer. So 95% of the time, if you do a tissue biopsy of a 𝘬𝙪5 category mass, it will show as cancer 95% of the time. So there's an off chance that the 5% would not be cancer. Okay, so that's why this is how I explain things. So there's the 5% chance that it can be non-malignant. Yeah.
Thank you, Doc. Thank you. Sir Sean, would you like to add anything?
No, I think Doc has done a great job. Yeah.
Yes. Thank you. Very clear. Thank you, Dr. Jansen. For our next question, coming from Ms. Gina, Escano, constipation. Okay, does constipation need colon cleanse?
Oh,
So sometimes
Sometimes.
if it's
I
yeah.
just I want to ask this question. Is colon cleansing like a because colon cleansing in Singapore before I came to Philippines was something that they did by taking some like homeopathy. I mean, sorry, some alternative alternative medicine kind of thing, right? It's not TCM. It's I don't know what it is. Right? They like very forcibly cleanse your colon, and there have actually been cases where people died from it. Literally, it tear a hole in your. I mean, and they are taking supplements, capsules of something. I don't know what it is, but like these are like natural herbals, and they are very very strong acting. And there are people who actually had like their GI like wounded very severely and actually died in Singapore before. So when we say colon cleansing in Philippines, what comes to mind? Is there colon cleansing in conventional medicine? Then of course we know the procedures of colonics and all that. Okay, and since you're in integrative medicine, maybe you can give us a little bit of information.
Yeah.
About
So
enemas, right? Enemas as well.
yeah. So colon cleansing is not well. It's being used by different schools of medicine. No, so may it be Eastern or Western.
Yeah,
We do a
correct.
lot of these. No.
Yeah.
Now colon cleansing is just basically evacuating your bowels of its content.
Okay.
Yeah. So there are a lot of ways to do it. You can take in castor oil, olive oil. Um, the protocol that your gastroenterologist recommends you or prescribes you before your colonoscopy, that's also colon cleanse. Okay, so this is for you to evacuate all the contents of your so that when they go in and take a look at your intestine, everything looks clean. There's nothing in there that's that might hinder the camera. Um, So you can also utilize, high fiber supplements like psyllium husks. So that would be cleansing plus. That would also consist of colon cleanse. You can also take in binders like activated charcoal, bentonite clay, um, modified citrus pectin. So these are binders. So these can also be used for colon cleanse. So main reason why you would want to do a colon cleanse is if you have a time deposit in your colon already. So in other words, your stool is already staying there for long periods of time. You need assistance in evacuating it. So that would warrant one colon cleanse. Number two would be to have a sort of a restart on your gut microbiota. So that would be another one. So if for patients who have gut dysbiosis, colon cleanse is very important. But not just any colon cleanse. No, after the colon cleanse, you have to replenish your gut with good bacteria, so probiotics, and to feed them with prebiotics, okay, so that they proliferate. So that's one of the things how we use colon cleanse. So it's used for detox. It's used for treatment of constipation as well. Yeah.
Doc, enemas, coffee enema. What's your comment about that? Sometimes, Doc, like, sometimes, especially like as we grow older and we eat, we go buffet, and maybe at some point in our life, like our viewers today, we really feel like maybe it's a good idea to really clean out our system. So I'm asking my TCM to do that. So she's giving me something very very natural and slow acting. So it's being done like slowly over 1 to 2 months. So slowly solidify the poop. Actually, when I went back to Singapore, okay, I don't mean to gross anyone out, okay? It's like sticky. It's actually sticky. The your environment change will actually cause the and then she's giving stuff to form the stool properly, bring the heat down. So when I first went to Singapore, my face was more reddish, more flushed, right? So now I just saw her before I came here. So she said, okay, yeah, it looks like the heat has been pulled down and out. So my face is not so reddish anymore. So there are things like that. So this is the TCM. I'm very curious. Coffee enemas, how safe are they? Have you ever tried an enema yourself? Is there any reason why you would or would go for an enema?
Okay, so I haven't done any enemas personally yet because I don't need them. So for coffee enemas, there is one clinic that I work with, which is Tree of Life Wellness Center. We do coffee enemas there. Now, the coffee enema is used for detoxification. Now, how does it do the detox? It basically cleans your bowel of its content. Okay, but on top of physically pulling out the stool, it also stimulates your liver to produce glutathione. So that's the beauty about it. Beauty about coffee enema, rather than just doing a simple hydrocolonics or colonics. Okay. Now, for those of you who are thinking of, hey, can I do this at home? Yes, you can, but you have to be instructed how to do it safely and properly. And there are coffee beans. There is a right coffee bean to use. No, you cannot use the roasted coffee bean that you can buy from the coffee shop. No, those cannot be used because the antioxidants of those are almost it's really low already, especially the roasted ones, especially if they are roasted quite heavily. Okay, the best beans to use are green coffee beans. That's the one that you have to use for coffee enema because green coffee beans still have intact antioxidants. Okay, so if you want to do the coffee enema, you can visit us at Tree of Life Wellness Center. Centro Holistico also does coffee enema. So if you want to try this out, you can. Now, for patients who had surgery within 6 months, you cannot undergo any enemas just yet. Okay, for anybody who did colon surgery or surgery in the abdomen or whatnot, so don't go for the enemas yet. So wait for 6 months. That's the time that you can go for the enemas. Okay.
Thank you, Dr. Jansen. Thank you, Sir Shyan Lim. Okay, just before we go to our next question, I just want to say hello to Miss Janet Koo of Child House Manila. Okay, so we have some follow-up questions coming from Ms. 𝘬𝙀𝙧𝙧𝙧𝙀𝙧. She is the one who asked about the Crohn's disease. Her follow-up question is, what is the dosage for the vitamin D3 and how often should she take the cleansing plus? Because we said it's actually good for her. She also said that she's taking Pentasa once a day as prescribed by her gastro doctor.
Okay, so vitamin D3 dose, I don't know because it depends on your laboratory. Okay, so you have to speak to a doctor who knows how to do the Coimbra protocol to know the right dose. How often do you take cleansing plus? Once a day would be enough.
Sir Shyan, shall we go to the next question? Okay. All right. For next question coming from another follow-up question from Ms. Chris Villanueva. Is cleansing plus and PPARS tablet safe for pregnant women? Good question.
Yeah, I believe so. I believe so. But I'm not managing any pregnant patients. No? I'm not an OBGYN, but according to Simply Nature, it's safe. So must be.
Sir Shyan, would you like to add anything? Okay.
No. Yeah.
All right. Okay. Let me just check the private messages. Okay. All right. We actually are getting a lot of questions tonight. Thank you so much for your questions. Okay. Oh, can I take multivitamin together with PPARS tablets?
Yes, of course you can.
Yeah, but take them separately.
Yeah.
Okay, because again, chlorella is a binder. Okay, so microalgae are binders, so it can bind to your minerals. So take them separately, but they can be taken on the same day.
Perfect. Thank you, sir. Thank you, Dr. Jansen. Next question coming from Mr. Durango JC. Can PPARS cure prostate enlargement?
Okay. We cannot say that something is a cure for one, no? Especially when it comes to prostate enlargement, which is multifactorial. In other words, there are a lot of reasons why your prostate can be enlarged. So just claiming that something would be a cure for one would not be responsible. Okay, so you have to identify first what is the root cause, why the prostate is enlarged in the first place, then address that. Okay. Now, in general, prostate enlargement, can it help? Yes. I have a lot of patients who are taking PPARS that we have reduced the prostate size already substantially. Okay, so from 40 plus grams down to 30s, even 20s, high 20s. So significant reduction. But again, it doesn't happen to all patients. So it cannot be a blanket prescription. You have to speak to your doctor. Okay. Yeah.
Once again, for those of you who wish to have a consult with Dr. Jansen Calalan, simply type in how to consult. Ms. Beth and Ms. Irish will definitely get in touch with you during the program and after the program also. All right. Another question. Okay. We talked about prostate enlargement. There's also a question asking about, is PPARS okay for liver enlargement?
Same answer to the previous question.
Yeah. Okay. Thank you, Dr. Jansen. Okay. Another question. This one. Okay. Can ultrasound and mammogram still work if I have breast implants coming from Ms. Angel?
Yeah. Except for mammogram. Mammogram, I don't know. I don't know if it will work because you have implants. But ultrasound, definitely yes. Why is it so? Because in mammogram, the machine would actually have to compress the breast. So if there is a silicone implant, that, yeah, you might have difficulty in doing the procedure. For breast ultrasound, yes, it would still work. It would still work.
But do those, just curious, do ladies who have breast implants more prone to having breast cancer?
Well, studies have shown that they are. Yeah, they are. Why? Why is it so? Because the implants, although inert, yeah, long term, you can actually mount. It can cause low-grade inflammation. So that's what they're saying. And if there are impurities in the implant, that can seep into your fatty tissues, the breast tissue. So that can increase your risk of developing breast cancer. But this is in theory. There would be doctors who would say that it's quite safe. It won't increase risk of breast cancer. Just because there's no study saying that it increases risk of breast cancer. But if you think about it, the implants, these are foreign objects placed inside your body. So we don't know if long-term, if there are substances that can seep into your, breast tissue that might be carcinogenic, or how your breast tissue would react to the substances that's present in the implant. So that's the risk.
Thank you, Doc. Okay. All right. We have an interesting question shown to us privately by Miss Althea. So the question is, if someone says, I tried everything, what makes PPARS different enough to be tried?
Okay.
How sure are you? How sure are you that you tried everything?
Yes. So I don't know what your everything is. And what's her health issue?
She actually didn't say.
Okay. I'll tell you. Okay. Since we always talk about cancer, then it's one of the safest bet that maybe she's talking about cancer, right? And I'll let you know this. In cancer, try as many good things that make sense as possible. All right. It's not one magic bullet that will cure you or help you fight against your cancer. It's everything that you do increases your success by a few by percentage points, right? So if you go for surgery, wow, you increase your success by 30%, and after that, if you do a follow-up chemotherapy, it'll increase it by another 30%. But if you do your chemotherapy liquid PPARS so that you preserve your bone marrow cells and preserve your immune system, then that percentage goes up. If you live a healthy lifestyle and eat plant-based whole foods, then that adds another 10%. Yeah, and if you take vitamin D, so what you want to do in cancer is try as many positive proven things, right? Things with evidence. Don't just go to, like, for example, some myth or stories, right? Or, like, for example, some direct marketing companies that they don't tell you the science behind it, right? You just want to do every good option. So, okay, next. But if you are, so I don't know the illness. If you answer, then yes. Another one I want to share, this one is direct from my personal experience. I met a person who is very serious psoriasis. He looks like what you would assume a person with leprosy looks like. His whole body is peeling, right? I can assure you, he has tried everything, right? To the point that it's his wife. His wife is actually one of our doctors. So it's the wife that sort of like forced him to try, because he has tried so many things and everything, and he's basically given up hope and told himself he's okay to live with what he has. All right. But to his greatest surprise, when he tried the liquid extract, he was able to be relieved from itch and bleeding for the first time in his life for years, right? And he actually went to Europe with the family on a European trip. He ran out of the Simply Nature products after the first 2 weeks. His last 2 weeks in Europe, he actually didn't have any major breakouts, and he wasn't able to eat his regular food because he's on a vacation in Europe, right? So yeah. How is it different? I don't know what you took in the past, so I can't tell you how is it different. But I just want to encourage you, if you have tried many things, that means this thing is something you want to really get well from, right? Don't give up hope, all right? And we are here answering questions. Don't give up hope. Keep trying. You never know. This might be the night you find. And even if our PPARS does not give you the full healing, even if it gives you improvements, and then from there it might combine with some other protocols that you tried in the past, and everything just comes together, right? So in your pursuit of health, don't give up. Don't give up. I've met patients who tried everything for many years, and then they found something and work. Sometimes it's not even Simply Nature PPARS, but as long as you don't give up, yeah, you're gonna be hopeful. Yeah, Doc. The doc say everything. Are you sure?
Yeah. So I think well, just to no offense, no, with this statement, but I think the question is wrong. Okay, it's a question of how do you know if it fits you?
Yeah, that's a good question.
Okay?
That's a good
Because there are a lot of nutraceuticals out there that can be used effectively for cancer. The question is, will it fit you? Okay? So, Simply Nature PPARS is proven to stimulate caspase-3. So caspase-3 is an enzyme that induces programmed cell death. Apoptosis, in other words. No? So it can kill cancer cells. It is also an immunomodulator. Okay? You can Google that, ChatGPT that, Gemini that, whatever, that's the answer that you're gonna get. Okay? But the question is, will it work for you? Yeah, so same thing with every other product out there in the market. Okay? Each and every product in the market has its purpose. So it's a matter of using them correctly and not using them as a blanket approach for just because you have a mass or you have a diagnosed with cancer or whatever. Okay, you have to know how to use them, and if at all, will it work? Okay, So that's the right approach there for me. So how do you do that? How do you do that? When get your cancer cells analyzed, do proper diagnostics. No, that's how you do it. And make sure you follow up with your doctors because mm, doctors have it doesn't mean that when we give you treatment right off the bat, it would immediately cure you. Um, at that moment, we give the recommendation because in our best judgment, that's going to be the protocol that would give us the best response. Okay, but we are not we're not Jesus. Okay? We're not Christ, Jesus Christ. Okay, we're not gods. So there is an off chance that the treatment that we recommended might not work. So is the nature of cancer. If it is cancer that you are, that you're coming from, no. So that's the nature of cancer. So treatment A, if it doesn't work, you have to go to treatment B. Okay, and the faster that you implement this, then the faster that you can get results. And you have to follow up, no? Patient compliance, patient adherence to treatment is very important for this to work. So yeah, so that's my take on it. So you have to know your enemy for you to be able to defeat it. Yeah. So that's yeah.
I think what I could say that.
You know,
Go ahead, sir.
recently I had a friend who called me from Philippines because she has a young member of the family whose movement doesn't seem very natural, right? So she actually saw the top pediatric orthopedic in the Philippines, right? And the orthopedic said, nothing wrong. It will grow. It will grow. The family member should be able to become. Things will work out as the family member grows up. But she called me to ask me for a referral. So thank goodness, a good portion of my family members are actually in the medical field. So I asked my doctor, my cousin, who's one of the top thoracic surgeons. So he actually referred a specialized pediatric orthopedic who was actually the head of the department in our largest children's hospital, who just came out from government to private practice. So this friend of mine actually flew down to Singapore with her family, and she told me it was really good. They got a diagnosis and a solution that they never got from even the top pediatric orthopedic in Philippines, right? So I'm just saying that you never know. You don't stop looking. Okay, we have not tried everything, and sometimes it's asking the right questions also. So it could be this particular orthopedic in Singapore has had patients who have similar things, and to him he recognized something that another doctor does not recognize because of experience. So that's why doctors it's a practice. So I guarantee you, the Dr. Jansen that you will meet in 3 years' time is going to be an even better doctor than he is today. It is definitely the case with doctors. Why? Because it's an experience. The more you see, the more you know. And if you are inexperienced, you didn't know all these things, right? So that's also, I hope everyone also understands. You may hear us saying something very different from what we are saying today. Okay, why? Because our information improves with more patients that we meet, more clients that more exposure, more medical conferences, more good questions from our viewers like you, which causes us to learn new things. I'm sure, because of the MG question, I was checking a lot of references, and I even got reminded of JAK inhibitors that Dr. Jansen spoke to me 3 years ago. So, I think our time is also coming up. So, I really want to thank everybody for your wonderful questions. Yeah, Sheila.
Thank you. I think I just want to say quickly, the honesty of the answers that you are getting from our two gentlemen here is one of the reasons I could say what sets us apart from other supplements.
Okay, thank you, Sheila.
All right. So I'm actually afraid that that's all the time we've got today. So, but don't worry, for those questions that we weren't able to answer, we'll have it answered privately or ask them next week on our next webinar next Thursday. So once again, we're almost at the end of the webinar. As we wrap up, I just want to ask for a very quick parting words from the both of you. Shall we go with Doc Jansen first?
Yeah, so I would just want to thank everybody, for staying with us here every single week, asking all these questions. There's no question that's stupid or you're too afraid to ask because it might come out as makulit or come out as stupid. Don't. The reason why we're here is for us to get educated, and for us to get educated is by asking questions.
Yeah.
I encountered this saying that I forgot when I encountered this, but it struck me. Smart people always ask us the most question, and people who are idiots are always the most noisy. Are always the noisiest ones. Okay, so so I really like the forum that we have because we encourage people to ask questions.
Yeah.
And we're also trying to as hosts, although we're trying to give you answers, we're also asking you questions.
Yeah.
Okay? So this is a very good interaction that we have, and it's quite good that you keep on engaging in the comment section. So please keep it up. People, don't be afraid. Share this program to anybody that you think that would that you think that we would be able to help. Okay. So good night, everyone, and I'll give the floor to Sir Shyan.
I will carry on from what Dr. Jansen says about questions. If you realize, right, if you're very good at asking questions, you're very good at using AI also, because it's about the prompts. And if you enjoyed our interaction today, then I want to encourage you. We have an upcoming last SMX event in November. We will be there live. So it will not be typing, ask a little bit, and then we answer, and then, we ask you a question, and then we don't get a reply from you. So the last time we had a live panel Q&A, it was so good. Everybody just kept asking questions. And, in a room of 30 to 40 people, and of course, most of the people who went to that program, it was about cancer. So someone will ask a question that is related to yours, and you can follow up on those questions, right? And you can properly interact. So I look forward to that. Once again, I thank you guys for your wonderful questions tonight. Dr. Jansen always says that we also learn from every program, and we do learn. We learn by being reminded of some of the things that maybe because we didn't encounter a patient like you, it's not at the forefront of our mind. But once we're reminded, it also encourages our interest to go and read up and study. So yeah, I'm reminded of the JAK inhibitor. So I will go and read up a bit tonight so that tomorrow I can talk to Dr. Jansen about it over dinner as well. So again, thank you, everyone. We are here. You are the reason why we want to do this, and we want to really help you and interact together and learn together. So I'll see you guys again next week, same time. See you guys next week. All right, I hand the time back to Sheila.
Thank you, Sir Shyan. Thank you, Dr. Jansen. Thank you also for our viewers for asking your questions and for considering our program as program of value while you journey with your own health battles. And of course, on behalf of our patients, thank you so much once again, Dr. Jansen Calalan and Sir Shyan Lim, for putting so much effort and care towards all of us tonight by answering our questions. Now, I just want to reiterate what Sir Shyan mentioned earlier about our upcoming big event. This is face-to-face, no? So we're calling all warriors who are battling against cancer, whether you are a patient, survivor, caregiver, or health advocate. This is your moment to gear up and reclaim your freedom from fear and uncertainty of illness. So, Defying Cancer Diagnosis. This is happening on November 15th. That's a Saturday at 8 a.m. to 11 a.m. Sorry, 8 to 11 a.m. And also, the location is at SMX SM Aura here in BGC Taguig. Please watch out for some more announcements about this upcoming exciting event for all our cancer patients out there. So if you or your loved one is battling any type of cancer or any health issue at all, remember, science is evolving and new treatments are emerging all the time. Keep informed and explore all available options. So please don't forget to like and follow our Facebook page, Simply Nature International, and Dr. Jansen Calalan's Facebook page, and Simply Healed Medical Group, and subscribe to our YouTube channel, Simply Nature. This is also to make sure that you get updated with our latest promos and events. Now, support your health and the natural way with Simply Nature PPARS, trusted by doctors. Don't miss the chance to save big stock on your health wellness journey, because for a limited time offer, or limited time only, you can buy 3 individual packs of Simply Nature PPARS soft gel capsules and get 1 pack for free. That is worth 3,700 pesos. Guys, 3,700 free? Wow, right? So please hurry and enjoy this perk and promo. Now, more than ever, it's important to strengthen your family's immune system, and Simply Nature PPARS can help support your bodies during stressful times. Reach out to your assigned CSO. So you have me, Sheila. You also have Ms. Jhen. We also have Miss Daisy and, of course, Miss Karen, for you to reach out and ask more questions about Simply Nature PPARS as well. We hope to see you on our next webinars to come. That is happening on October 9th, Thursday. That is once again, same day, same time, every Thursday night at 7:30. Your commitment to healing and recovery inspires us. And remember, every step of the way is a step forward. Once again, this is Simply Healed webinar powered by Simply Healed Medical Group and Simply Nature International, because your curiosity about your health conditions and your victories over cancer and other health battles are what keeps us going. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night, and God bless you all.